Hello everyone, I am Dr. Roshi Satija and today we'll be talking about couples who want to conceive naturally. In this video, we'll be talking about what is the fertile period, that is, on which day of the menstrual cycle should the couple have contact so as to increase their chances of having a baby. We'd also know about the various ovulation kits which are available in the market. Are they really useful? So first of all, the lady should have regular menstrual cycle, that is of approximately 28 days. When the lady begins her menstrual cycle, it is taken as day 1, and as the day passes by, we take it as day 2, day 3, and by about day 5 to day 8, one follicle starts growing. This follicle grows and attains a size of 18 to 20 mm. This is the time wherein the follicle ruptures and the egg is released. This process is called ovulation. This is the time where the couple, if they have contact, the chances of having a baby increases. Studies state that 48 hours prior to ovulation, if the couple has contact, the chances of having a baby increases. Now we'll talk about the ovulation prediction kits. What are these ovulation prediction kits? Ovulation prediction kits is done with the help of the urine which is added in the well provided in the ovulation kit. If the lady has a rise in the LH or the luteinising hormone which rises just prior to ovulation, this kit would show 2 lines, which means the ovulation is about to occur. But this LH hormone which rises has a very transient rise. It rises quickly and then falls. So in 30 to 40% of cases, this test would be negative. That is, if the ovulation has occurred in the morning and the lady does the test in the evening, it would come as negative. The couple would miss the exact chance of detecting the ovulation and hence decreasing the chances of conception. There are various mobile apps which claim to detect the exact day of ovulation. But as we are all aware that the day of ovulation of the lady varies from month to month. That is, if the lady has ovulated on day 13 in one cycle, she would be ovulating on a different day in the other cycle. So these apps can give you a basic guideline, but the accuracy of these apps is very less. So to sum up, one should always remember 2 to 3 things when they are planning to conceive naturally. First, the lady should be having regular menstrual cycle and the couple should have contact from day 8 to day 18 of the menstrual cycle. And these ovulation prediction kits have a very limited role. If a husband is outstationed and he plans his visit during the ovulation time, then these kits can be used. But if the couple are having any problem during sexual intercourse, if a lady has vaginismus or the husband has erection and ejaculatory problems, they should consult a doctor. If a lady has irregular cycles or does not have menses, then also they should consult a doctor. If you have any queries pertaining to infertility, there are links attached here, or you can visit our website for more information. We'd be very happy to help you. Thank you.